I would just like to welcome Will, who's a colleague from the UK, as you've heard. Will is actually such an esteemed person to help us teach us about exercise that today. So Will also, in some of his other roles, he is the Vice President of the British Rheumatology Society. He was an invited speaker to Australia and got to go to Tasmania 2 years ago in 2023. And he's also involved in education and teaching at Manchester Metropolitan University. Will and I are very lucky to have worked together, and we're co-chairs of the Rheumatology Physiotherapy Professional Network in the UK. And Will also is an extremely experienced expert clinician in the world of rheumatology and spends most of his days and nights helping that be shared with professionals and patients. So I'm very grateful for Will to step in for me and share his expertise with you. And over to you, Will.
Thanks very much, Carol, and good evening all. Thanks very much for the invite to speak. I should add a bit of context. When I was in Australia with you guys 18 months ago, I'd recently had a musculoskeletal injury and I was on a pair of crutches hobbling around this Australian rheumatology conference. And I got some real first-hand experience of what it is like to go round a conference centre on a pair of crutches with only one leg working very well. And I also got a really good perspective of what it's like to be somebody living with a limitation and having to navigate the health service. And it's made me a much better clinician because I'm probably a bit better at understanding why people get frustrated when they can't get hold of their healthcare team, and why we have to have a responsibility to look after our own health for the 99% of the time when we're not sat with an expert, and instead the expert is ourselves. So we're going to talk a little bit about how we are experts in our own condition. That was the Australian conference. I went to the European conference last year, and that's when I did something similar to what Carol did with, was it Faye in the group here, who was sat at a stand telling everyone about Lupus Australia. Well, I spoke to the Lupus European leads, and there's some really interesting work that's been going on across our continent with regards to what we do with self-management for lupus, and how you can better improve your outcomes through your day-to-day routines. Yeah, we're going to talk about exercise in lupus and think about the current evidence base. So what are we best spending our time thinking about? We'll talk a little bit about the national guidance, and apologies, I'm going to talk from my own expertise, which is the European guidelines, which are, of course, eligible across the world and well respected from that point of view. I will briefly mention the UK exercise recommendations, and I'll also veer slightly out of lupus into some other inflammatory rheumatology conditions that have a stronger evidence base. And partly this is going to be informing you of what the story is out there, what the evidence shows, but also I hope it's going to allow you to think about your own habits and why we think it's important to keep as physically active as possible. So we are going back to 2023 with two sets of guidelines that came out of the European Alliance of Associations for Rheumatology. And the first one was the broader lupus guideline, and that gets updated every 5 to 10 years. So it was quite a big year, 2023. And this was the update. And you can see how important it is because there are about 40 authors on there. And if I'd have had time, I would have picked out the names of the Australians on that list and put you a little map of where they've contributed from. So I'm going to leave that to yourself, testing your eyesight and your knowledge of your local rheumatologist to see if there are any local names well known to you on that list. But this is a global authorship group there. And it had a number of core recommendations or overarching principles. So 5 areas were picked up. And the 5th area was what we can do when living with lupus that's non-pharmacological. Excuse me, the 3rd, not the 5th. So the 3rd recommendation was number C, letter C rather, and it says non-pharmacological interventions, including sun protection, smoking cessation, healthy, balanced diet, regular exercise, that's my red ink and bold there, and measures to promote bone health are important to improve long-term outcomes. So this is the broad management document with all those clever authors, and they've said, look, we do need to think about sun protection, smoking cessation, healthy, balanced diet, bone health, and then regular exercise. So a few components within that non-pharmacological management. And it's quite rare we get an internationally agreed guideline that puts these kind of elements high up in that kind of headline recommendation. So it's good that we're seeing the recognition of non-pharmacological management. So if that was the broad document, we then had a specific guideline group, slightly fewer authors, but still across the world, they have been selected or contributed, and that's for the non-pharmacological management. So that's to build on the previous broader management update, the idea of what we do that isn't medicines. So there are 12 recommendations for the non-pharmacological management that came through from that document. And it looks at the evidence base as well as expert opinion. And that's one of the problems we do have in these less commonly seen diagnoses. We can get a bit stuck for how many people have done research in the area. And therefore, evidence is part of the story, but the other part is expert opinion. And these are really strong experts contributing to this. So if there was 5 overarching principles for the general guideline, there was 4 overarching principles for the non-pharmacological. And I should say this document lumped together lupus and systemic sclerosis or scleroderma within that guideline. So the 12 recommendations, I've just picked out the 3 that are relevant to this evening's talk. So firstly, physical exercise should be considered for people with SLE. So that's quite broad. Getting a bit more specific, in people with SLE, patient education and self-management support should be considered. Why? For improving physical exercise outcomes and for health-related quality of life, and could be considered for enhancing self-efficacy, so that ability to look after yourself as such. And then the one that really speaks into the talk is recommendation 9, that talks about aerobic exercises should be considered for increasing aerobic capacity and for reducing fatigue and depressive symptoms. And this is quite interesting, where the first bit's obvious: do more aerobic exercise to improve your aerobic capacity. That kind of makes sense. But then the second bits are a bit more interesting, in that fatigue is often the #1 reported limitation that people with lupus report. And yet we know aerobic exercise can reduce fatigue. So that's quite nice. We've got a treatment that's non-pharmacological that can hit one of those biggest concerns. And also depressive symptoms. So we know that aerobic exercise can improve mood, another important angle to be pushing into. So what does it say within that document? Well, 3 areas that we can help with kind of exercise activities or active participation. And the first bit is a little bit about what we're doing today. I don't particularly like patient education as a terminology, but the concept is this is a process that helps people make informed decisions about their health by providing them with information and resources. So the more you know, hopefully, the better decisions you can make with regards to the treatments you choose to do or what you choose to do with your day-to-day routine that supports your better long-term health. And the goal of such patient education is to improve health by helping people go along with medical treatments and live healthy lifestyles. That go along is a phraseology I've put in. It sounds slightly more Australian than English, which I'm quite proud of on reflection now. But you should go along with the ideas because you know more about them. Supported self-management. So self-management sounds a little bit negligent, as in, I've told you what you need to do, off you go, good luck, don't come back again because I've told you. You can self-manage, you don't need me, you can self-manage. These days, supported is the key word there, in that we are trying to get people to do the best they can in their day-to-day routine, but we're supporting that. So the more knowledge, skills, and confidence you have to manage your own health, the better outcomes you might have. And there's 3 components of supported self-management that are picked out. This is UK NHS guidance, but the 3 components is something I think you're all doing in this group. I certainly heard it in that first 5 minutes before we kicked off formally. So peer support. So this is when people with similar long-term conditions or health experiences come together to support each other, either on a one-to-one basis or a group basis. And peer support is enabled through relationships that build mutual acceptance and understanding. So we've shared some bits we're all struggling with today with regards to how hot it is and how we're coping with that. And that peer support can be basic, as in what the temperature's like, and we all suffer or have an experience of that. Or it could be more condition relevant. My lupus is flaring in this way. Have you ever had it like that? And sometimes hearing advice from people living with the condition is stronger than hearing it from your doctor or your physiotherapist or your health professional of some kind, because it comes with some genuine empathy when it's somebody who is also experiencing directly those issues. Self-management education's in there as well. So it's any form of education or training for people with long-term conditions that is focused on helping you to develop knowledge, skills, and confidence. And then the last bit is slightly more challenging to come across, so health coaching. So how we support people to make more informed and conscious choices about their health. And your health coach could be somebody who wears exciting athletic wear and you pay money to, or it could be somebody who you live with who is just very supportive and able to coach you with your health. Some of you may well be health coaches to people you live with. It's not a niche role. It's not something we should be spending our inheritance on, but rather something where we have somebody who cares about what we're doing, our outcomes, and how we're maintaining the best health possible. So we'll come to recommendation number 9. So in people living with lupus, aerobic exercise should be considered for increasing aerobic capacity and for reducing fatigue and depressive symptoms, like I said. So that's 3 angle of why we want you to be as physically active as possible is reflected in the evidence and recommendations there. So apologies, the slide's not come out brilliantly and it's a bit fuzzy on some of the smaller words here. Some of you may be taking exciting medications that have changed your life, and that is fabulous if you found medications that help. I hope most of you have, and you might recognize some of this terminology from those medications. You could be using a TNF alpha or an IL-17 or such medication, but this is just what the body does in regards to when we exercise, and this is for everyone. So we know by working on our aerobic exercise, it can improve our cardiovascular outcomes. So regular exercise reduces fat mass, and that's a useful thing generally. It improves your, I've lost my last word there, your blood pressure. So you can decrease your blood pressure by regularly keeping your heart and lungs going with such exercise. It can slow down atherosclerosis, so the hardening of the arteries that can cause heart problems later on in life, and it improves our insulin resistance. So these are reasons all of us should be trying to maximize our aerobic exercise, despite the limitations that might be thrown in front of us. And that's for anyone. When we think about having a long-term condition, for instance, such as lupus, well, we know that exercise has a direct response on inflammation, and aerobic exercise that's within your tolerable level will decrease some pro-inflammatory cytokines, such as TNF alpha, which is one of the ones we can see in these kind of conditions. And then why do we need to do this kind of exercise? So this is the proposed mechanisms of anti-inflammatory components of your exercise. And like I say, we're not saying this is instead of medications. This is in addition to your medications. And if your medications make you 80% better, why not throw in some exercise that gives you a little bit more on top of that? And if you were to be offered a treatment that was anti-inflammatory and could improve your symptoms by such amount, you'd probably take that tablet. But this isn't a tablet, this is a lifestyle modification. So we know that regular exercise has impacts of an anti-inflammatory nature on your muscles, on your fat cells, and on your blood vessels. And again, I've shared the detail here because you might recognize some of those three-letter acronyms with regards to your ongoing lupus care. Certainly the CRP is interesting, a blood marker of how much inflammation you have, and we can decrease that with exercise. So we do think that exercise is medicine, but like I've said, medicine is medicine as well. So given that both medication and exercise may exert anti-inflammatory effects, although through different mechanisms, it seems logical to suggest that the combined effect of both may optimize outcome. That's a rheumatoid arthritis paper, but is applicable across other rheumatology diagnoses. So we know that medicine helps control inflammation significantly. We know that exercise can add to that. And this is a very interesting study where we're moving outside of lupus, but into axial spondyloarthritis, another rheumatology diagnosis, where this study group in the now where were they? I'm in Norway here, so we've gone very cold now suddenly. This is Norway, Norwegian research, where they found their 3 months of exercise, high intensity exercise is what they looked at there, which is heart rate of 90 to 95% maximum, sustained for 5 minutes on a few periods in this trial. They found that when tolerable for this patient group, led to the same amount of disease activity control as the injectable biologic medication. So it's as good as when used in combination with. So again, this isn't choosing one or the other, it's supplementing the benefit you can have from your medications by means of exercise there. So what can exercise do for you if you can find a level that's tolerable? Well, looking at two different components here, and in the red in those boxes is what you can achieve with strength training, and in the green is what you can achieve with your fitness work, your aerobic training. And this is slightly depressing because it tells you how long it's going to take. And in very pale writing, you can see the number of months across the lower component of the screen there. So it will take a couple of months before you see strength improvement or ability to do things more easily or decrease pain. Perhaps 3 months before we start to see cardiovascular improvement, so you can use oxygen more effectively, or you can decrease your fat mass, you can improve your risk of cardiovascular events, and you can decrease the severity of your condition, we think. About 6 months, you might start to see the muscles have definitely grown and the fat mass has gone down significantly from strength training. And then 12 months plus is when you'll start to see, actually, I feel a bit better with managing day-to-day activities and have sustained those benefits. So it does mention the strengthening progressive loading. So we don't want to overdo it. We don't want to cause injury or adverse effects through these type of exercises. This was just a study I was going to share to show you don't have to go to the gym. And this is a study that looked at 30 minutes of walking 5 times a week. So if you did nothing with regards to gym or exciting athletic wear or whatever it may be, but you just opted to walk 30 minutes a week, 30 minutes a day, 5 times a week, that would decrease a number of the inflammatory markers. It would decrease your blood pressure, and so on. So this is a really core study that we've seen recently published in the UK that shows it doesn't have to be super exciting dynamic exercise. Even just increasing your fitness work with a bit more walking be sufficient to decrease the inflammation. If you're not able to run yet, you can still get benefit with weights type work. And certainly from that, I'll go back on the slide. In the red here, we can see outcomes from just the red without the green, where we still get improvements in quality of life and functional abilities there. So it's probably more sustainable if you have a variety of different exercise routines and regimes, but just walking alone could do it. Just strength training alone could do it. Looking at that example. So we're going to go to the well, I suppose it's global document, but it has come from the European group, and you can find this on Lupus Europe. And just to introduce, this is an exercise program that they wrote that is in 5 levels, endorsed by leading European lupologists. And studies show that the only thing that is clinically proven to help lupus fatigue is moderate exercise. So this is Lupus Europe saying, we as lupus patients ourselves do, however, realize how difficult it can be to start exercising when you feel fatigued. And that's why they've developed the program from their own experiences. So exercise doesn't necessarily mean that you have to run a marathon or go to the gym. With this program, we want to show that you can do it no matter where you are and how you are feeling. You should be able to find a level that suits you each day. And the goal is, of course, to increase in level whenever you can. But you'll probably experience that you have to go down a level at some point. Don't despair, this is quite normal. And the most important thing is that you do one exercise developed with the support or endorsed by day. So just one exercise gradually increasing is fine. It will improve your fitness level. So that's 5 levels of the Lupus Europe program. I'm just going to show you what level 1 looks like before we're all going to have a go at level 3. So level 1 is the lightest level and is hopefully something that would be tolerable for everyone in the room here. Whether you can all do level 3, we will judge in about 10 minutes. So we're looking at arm circles, arms swinging above the head, contraction of the buttocks and legs. So this is mostly a lying program. Pelvic raises, lying knee lifts, and relaxing hip twists. So that's level 1, which is all on the floor or on your bed, gradually getting things going. I thought not many of you would have the opportunity to be lying down to do our exercise session together, but I'm hoping you'll all be happy to stand up in a moment and give us 7 minutes of level 3. Just do as much as you feel comfortable doing. The music is definitely Euro pop, so I don't know if Euro pop's made it across to Australia, but I apologise if it hasn't done, and this might be your first experience of such a sound. But if you are now ready and are happy to stand up, I'm going to do this with my camera on just so you can have a laugh at me if you can see me at the same time as the video, but it's probably better to watch our 3 expert patients doing their exercises. And then we'll come back together in 7 minutes and compare what we thought. So off we go.
Level 3, standing. This level is for when you are able to stand up but not walk for longer periods of time. For this program, you will need a kitchen chair or similar, a floor mat, and a wall to lean against.
If you can't lie down, you can do some twists in your chair. So do feel free to join in if you're not able to lie down.
Wonderful! That was level 3.
So that's level 3. So the level 1 I just showed you the pictures of, there's obviously a level 2, level 4, level 5. So different elements you can come back to, and those videos are on YouTube for you to access as and when you might like to. And if it becomes a 6-day-a-minute habit for you, I think that would be a good potential outcome. So we're going to move on to the kind of more specifics of what we should be doing and how we should be doing it. So we're going to take a quite broad analogy of what you might do with regards to your exercise habits, and we'll go through some of the specifics in that as well. So we're going to think about how you might launch a spaceship. And I've broken this down into, 7 different components. So firstly, how you might think about building your exercise habits, which we're going to call building the rocket. We're going to talk about your support networks and your accountability, so how you might choose your crew for this journey you're going on. We're going to think about what you want to pack in your bags for your metaphorical space journey that is your exercise habits. We'll think about why often spaceships fail to launch and why often we struggle to keep our New Year's resolutions. Seems appropriate to mention halfway through January, perhaps. We'll think about how you fuel your rocket and then what you do in that preparation phase to maintain your habits there. So firstly, kind of building your rocket, you might want to think about what is your exercise goal? What's your activity goal? Why are you committing to these new habits or to maintaining old habits, if that may be? So have a think about maybe what you're currently doing exercise-wise, how you're doing it, when you're doing it, and with who you're doing it. And you may want to think about a SMART goal. So this idea of giving yourself a target that is specific, measurable, achievable, relevant, and time-based. Looking at time-based, I'm aware we've only got 13 minutes left together, so I'm not going to dig into that SMART acronym, but please have a look at it if you want to think. We will be mentioning the Couch to 5K, which is a NHS England recommendation of moving from being couch-based or sofa-based to managing 5 kilometers on a walk or jog. So at the moment, you're welcome to put this in the chat if your fingers are up to it and you're happy to chat away. What are you currently doing? And thinking about, is it measurable? Can you tell how much you've done? Is it sustainable? Will you still be doing it after the January enthusiasm of New Year's resolutions has faded or whatever it may be? Is it fun, what you're doing at the moment for your exercise, physical activity? Do you do it by yourself? Are you doing it with other people? Is it accountable? So does somebody monitor that you're doing it as regularly as you should do or care about you doing it? Is it a fitness thing? Is it a flexibility thing? Is it a strength thing? Or is it all 3? And then what happens on a bad day? What happens if you're flaring? What happens to those habits that you've hopefully committed to? And are you meeting physical activity guidelines within that? So choosing your crew is important, and we are really fortunate now that we do have Zoom and Teams and online options to meet up with other people. And it could be your crew is the person you live with who is fantastically encouraging and engaging and values your time and wants you to maximize your outcomes. It could be you want to speak to somebody who's living with a similar condition, and they're the person who will ask you, have you done your exercise? Have you done your walk? How did you get it on? How are you on a bad day? But having that person to go on that journey with is really crucial to maintain your habits. We'll think about packing your bags for that journey. So what do you need to take with you as you commit to a different physical activity regime? And it could be thinking about, well, why are we doing this? Well, we know that exercise for people living with lupus can help with a number of important things. So it can help with your physical function. It can decrease your pain levels, and it can decrease your disease activity. It can make other things easier. So if you commit to a 20-minute a day exercise regime, it can then make components of what you need to do in your day-to-day easier, climbing the stairs, picking up the kids from school, whatever it may be. We do these exercises not so that you're better at the exercises, we do them so that you're better at the things that are important in your day-to-day life. You'll hopefully get a mental boost. This is quotes from some people we worked with on our lupus studies in the UK. You might get a small sense of happiness from managing the routine. It might reduce some of your painkiller use. You might sleep better. It should certainly decrease the fatigue, and it should increase your strength as well. So this is the kind of take-home bit, as there was a few questions about what should I be doing and at what level. So this is the UK guidance, which I know has been adopted elsewhere. I should have found the Australian guidance, but perhaps someone could come in on that. But the idea is each week managing either 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity. So the vigorous intensity could be playing sport, going for a run, climbing the stairs. The moderate could be a brisk walk, a bike ride, a swim, or the exercise routine we've just done, perhaps. If that's the fitness bit, we also need to think about building strength, and the recommendation is twice a week, doing something that builds strength, which could be gym work with dumbbells. We've got in the picture there. It could be yoga, or it could be carrying heavy bags. So it could be the weekly shop that counts as one of those building strength regimes. And then the third component is something we slightly touched on with the Superman exercises or the Superwoman exercises, is improving your balance. So doing something that challenges your balance twice a week. And the pictures here are crown green bowls or something like that, Tai Chi perhaps, or dance activities. And then the final component is just minimizing how much time we are spending being sedentary and trying to be a bit more upright and active within perhaps the restrictions of your job. So this is the concept, and you've all seen videos of rocket launches that haven't worked in one way or another. So we all build new habits that don't always stick. And this is the idea of why do we fail to improve? We're going back to 1994 for this piece of research. I think that's 30 years ago. And this looked at how many people with axial spondyloarthritis, so a different rheumatology diagnosis, were still doing their exercises. And about 85% were doing it after 6 weeks, about 60% after 9 months, and then after 18 months, about 50%. So we are all prone to losing focus, target, and capabilities within that. And why? Again, this is 533 people living with rheumatology and musculoskeletal conditions. So lupus is within this, but the suggestion is that we might stop doing the exercise because we've had pain or fatigue flare. we've had lack of doctors' support, is the phraseology there, or a lack of physical activity programs, so gym or community-based resources to support exercise. So there are a few ways we can get blocked, and I just thought I'd share some we've had from previous sessions that people have thrown at us, and this was already in the chat, the idea of time pressures when life gets busy or stressed. It's the exercise habits, it's your own self-care that tends to fall out of your schedule. It could be fatigue that's stopping you. Stress and anxiety is certainly there, and that could say depression and anxiety. This was an image I used for a COVID presentation where we were all locked in our houses and not allowed to leave for a period. But actually, living with a long-term condition that limits your physical capabilities can be like that, that you feel locked in a house or locked in your neighborhood and not able to do as much as you'd like to do or would previously do. And the final one to mention, I thought, was the expert trap, in that we're not sure what's the best exercises, so perhaps we shouldn't commit until an expert tells us what to do. Well, I hope both Carol and I have explained here the idea of what's the RA exercises, what's the lupus exercises. There is no real expertise there with regards to which is better for which condition. So doing something regularly is always better than not doing something. So delaying a habit until you've got the perfect exercise regime that the expert's shown you is probably letting yourself down somewhat. So how do you fuel your rockets? I don't think actual genuine rockets are fueled as per the picture here, but how do we fuel ourselves to improve our exercise habits? Well, it could be digital help, and it could be you have a look at something online that will either monitor what you're doing or support what you're doing. So I really like Map My Walk, which is an app that allows you to put in your home address and say, I want to walk 2 kilometers, and it tells you where to go from your house. So, you know, turn left here, turn right there, and you'll end back at your house and done exactly 2 kilometers. And that's quite nice. You can measure what you're doing and gradually increase it. The couch to 5K is quite nice if you want to be able to walk or jog 5K. I think certainly the Lupus Europe regime is the #1 choice here. Or it could be the Active 10 is a series of 10 exercises similar to the ones we've just done, recommended more broadly. Non-digital help. So what else can keep you active regularly? It could be if you do have a dog in your life, then you have to go out and walk the dog a few times, and that gets you going no matter how hot and horrific it is out there, outside of the air conditioning. It could be you have a routine of stretches or prompts around your house. So every time you open the fridge, it reminds you you need to do your Superman exercise or whatever it may be, something that just gives you that routine. Or it could be you want to look at group challenges, support or encouragement. So it could be this group commits to walking, I don't know, 1,000 kilometers in February, and between the group of you, you each say, well, I did 10 and I did 12 and I did 16, and add it all up. As a group, have you managed to walk from, I don't know, city A to city B in a metaphorical term? So this is your countdown to launch. We were in our last few moments together, and I'm sorry you'll have a chance to come in and chat, but this is the chance, and hopefully this is the nudge for you to think about your exercise habits, either to congratulate yourself for what you're currently doing or to think about adding in something new or different. With regards to that, as you plan your future exercise habits, think about, is it measurable, sustainable, is it fun? Are you doing it with other people? Who cares if you don't manage to do it? And what happens on a flare or a bad day or an escalation in pain during flare-up? Yeah, I think that's well expressed there. So this is meant to be somewhat inspiring, that you feel all set to go at this point and ready to launch yourself into the new habits. It is a little bit of trial and error, not that you want to throw error at yourself. We do quite a lot of work with chronic fatigue syndrome here in our clinic, which is a non-inflammatory fatigue issue, or ME as it's sometimes called. And we look at very careful monitoring of activity and gradually increasing that by 2 to 5% a week. And it could be that 2 to 5% rule of I'm having a flare, I'm particularly struggled at the moment, I'm going to do 20% of my maximum capabilities, but then the next flare I'll do 22% or 25% and just gradually peak it up. So there is an element of monitoring to ensure you're not overdoing it on those bad periods. And there's a smartwatch or there's an app on your phone or something that will allow us now to better monitor what's the correct level for us and not get too frustrated when we don't achieve everything we'd like to on a flare period.